You're live.
All right, good morning. It is the last day of April, April 30th, and this is Senate Health and Welfare. We're looking at a bunch of bills this morning that we'd like to begin to fine tune and vote out. And so we're going to begin with H611. And Jen, you're here with some language for us.
Yes.
We've been working on this one for a bit. This is the DEVA bill.
611.
So do we have a new
You have a new,
edition? New draft.
yes, so Jen Carvey, Office of Legislative Counsel, there is a new draft 2.1 on your webpage. I've added some new language from the chair for your consideration. And this does not include the HIV PrEP language because it still seems to be in flux.
Well, I think we had asked for some consensus language from folks by Monday afternoon. Today is Thursday. We'll have to make up minds up.
Right. We received a couple of items overnight. But don't know where you want to go with the different.
Okay.
So this is H11, an act relating to miscellaneous provisions affecting the Department of Vermont Health and Access. We have the two provisions we looked at last time, which is adding in some language specifying that the drug manufacturers can't require certain information from a 340B covered entity as well as their contract pharmacy in order to receive acquisition of the 340B drug. We still have the struck through language in subsection D from the House. And the second instance of amendment was striking the 2026 and moving it to 2027 for OPR's role in the certification. This is a new potential amendment. There hasn't been yet either, so I'll just walk through it. This is a potential new section directing the Department of Financial Regulation to report to this committee, the Finance Committee, and House Healthcare on the estimated amount that health insurance premiums would increase if Vermont were to enact legislation requiring health insurance plans to cover GLP-1 medications, with the full official name, for all USDA approved indications, including the amounts of the state's financial obligations for defrayal of premium increases for qualified health benefit plans and for premium increases in the state employees' health. So I basically used similar language to what you had in the biomarker bill that you sent to the House for this analysis, but having DFR look at what it would cost, what the state costs would be for requiring plans to cover GLP-1 drugs for all FDA approved indications.
So the reason I put this in is there are some concerns by folks who are using GLP-1 that that coverage for the drug has been shut off. And they're very dependent on it, and it's important to the patients. If we put in, I asked Jen originally to put in coverage for medically necessary use of GLP-1. And your response was that would cause
so there'd be a fiscal impact. There would be state defrayal and the cost for the state employees plan, which I believe may have stopped covering for certain indications and the teachers' plans.
Expensive drug.
pardon me?
It's a very expensive drug, right?
Well, I've heard from some folks it's $400 a month, so it's a lot if you're on a budget.
And I don't know, but part of the reason I asked Nolan to be here is I didn't remember from the conversation on the biomarkers whether DFR think this is an actuarial requires actuarial analysis for them, and whether that's something they can maybe able to do within the
Yeah, there was one case where they could do it, and there was one case where they couldn't. Those have to figure out
Which
where this falls.
Okay. Well, I mean, I think it's important for us to understand the effect. The cost for the patient is significant, and if it's a life-saving drug, make sure that it's available when it's medically necessary. That's what it is.
So, can you just tell us what this will do exactly? I'm worried about our premiums, obviously.
So that's what it would have DFR to come back with. It's information on,
Study.
yes, this is right. So this, the original request had been put it in and I said, that will have a fiscal impact of unknown quantities. So this is having DFR cost out that.
Thanks, Jim.
Okay, so that's there. We can say yes or no as we go along.
And that's all I have for this amendment. As I said, the HIV PrEP medication issue still seems to be
That's our amendment.
a bit in flux. And I don't know if you want to hear from the stakeholders to try to figure out.
Let's take a minute to hear briefly. I see the two stakeholders are where
Courtney's in the hall, I think.
Courtney is in the
It's
hallway.
crowded.
And we got Courtney. He's out there chatting. So Courtney, thank you for coming in.
Yes.
Gail is here, and I know that we had sent you off to come to consensus on prep and PEP. But Jen has indicated she got two separate notes. So what would help me is to hear from each of you. Very quickly,
Sure.
and then this committee can make its own decision.
You'd like to go first? Sure.
Okay,
Gail Stats on behalf of the AIDS service organizations, and on this issue, I'm also representing the Network Against Domestic and Sexual Violence and Planned Parenthood. So there are four parts to our proposed amendment. We have reached complete consensus with DEVA on the Medicaid. So there's no contention around that.
and this is a Viva bill, so this is good.
Yeah. And that would be what I sent to Jen, sections 1 and 3.
Okay,
Sections 2 and 4 are the ones that are a little bit in flux. And I have a suggestion for that. And Emma, please jump in if I did. So in this amendment that's being proposed to the committee right now that Jen just reviewed, there's a piece in our proposal that would require DFR to study the impact of including PrEP and PEP in insurance plans. So perhaps we could add something related to PrEP and PEP to the amendment that you are looking at. And there is, and Courtney, you can jump in on this. We have not reached complete consensus on number 2 in the amendment that we provided to Jen related to coverage of only PrEP, pre-exposure prophylaxis. We're not touching PrEP with private insurance because that triggers defrayal. But PrEP is already mandated to be covered by the feds. So there could be no defrayal issue. So we had proposed that the language state that without any coinsurance, et cetera, co-pays, that the insurance companies cover PrEP. We use the exact language that DFR had presented to us in our amendment. And so that's where we're at with that. But for Medicaid, we're all set. And then we have the private insurance using DFR's language proposed and the possible study. One or the other of those last two items would be
okay,
acceptable.
got it. Okay, and so I know that Mary Block is here from DFR. And Courtney, do you want us,
If it's okay with the committee, I would prefer for our regulator to
okay, so,
first, and I'd be happy to add anything if we need it.
No, it was emailed to me last night. So
yeah, well, we haven't looked at it,
on the
so
screen if you want.
I thought we would have it Monday, so this is hard for us right now. So Mary, thanks for being here. So you want to comment on this whole issue for us insofar as DFR is affected?
Sure. So, Mary Block, Deputy Commissioner of Insurance for DFR. Unfortunately, I have to slightly disagree with Gail because the language that she's using is not exactly the same as the language that we proposed. She's changed the language around, and I think that change has impacted the effect of the language. And so we could probably work through that with Ledge Council, but we would still need to do that. I have not seen the latest version that she sent to Ledge Council unless it's no different than what's been going, what the latest version was yesterday. Unfortunately, I didn't get a copy of what was sent to Ledge Council this morning, I believe. So there's some defrayal implications that are that I still question. Obviously, the committee can choose whether they want to do defrayal or not. But the way the definition of HIV preventive drug reads right now, it would require the coverage of every single HIV preventive drug that is approved by the FDA. That is not what the ACA requires, and that is not what's recommended by the U.S. Preventive Services Task Force. It requires that PrEP drugs be covered. It does not require that every single drug be covered with no cost share, no co-payment. It's a slight variation, but it's a variation. And given that we are in an uncertain, shall we say, environment with respect to how defrayal will be defined, I'm trying to be very exact right now. We have an outstanding notice of benefit and payment parameters rule from CMS that would require us to pay defrayal on everything that we've done since 2011, every mandate that we've added since 2011. And that will change the guidance on what a defrayal means. And so we don't yet know what that impact will be. We should have gotten it by now. It is very late. And so
I can relate to that one.
Yeah, every state is waiting with bated breath to see how this thing comes out at this point. We are supposed to, be doing rate filings within the next 2 weeks, and we don't even have final rules from the federal government. So we may be able to tweak the language. I can work with Jen to tweak the language to see if we can get it to a place where we're pretty sure we won't have defrayal.
So
But
I understand.
It's not quite right.
Understood. So it's been not every drug, but it's some or some drug that would help cover. And so we're running out of time, and we don't have time for a continued negotiation on this thing. This is really upsetting to me, and hugely upsetting, because we had honestly, Ledge Council doesn't have the luxury of the time that you're talking about. We asked for some consensus information on this, and we haven't gotten it. So I'm going to say we're going to leave our amendment as it is. We will vote tomorrow morning when we come into committee at 8:30. If we don't have anything then that everybody can agree with, it's gone. That's the end of it. This has really gone on way too long. And I know that with the brains working together, because there are good heads in this room that are working on this, that we can come to consensus. So I'm asking you to do that. And so we're going to move on to the next bill.
That's one question.
Sure.
Corey, you had indicated to us, going back to Senator Bullock's comment, is that coverage of all this could run $100,000 to $200,000. So that's still where we are.
I would just say Courtney Harness, Blue Cross and Blue Shield of Vermont. I would say first, I share the frustrations of the chair, and second, also would say that I agree with Deputy Commissioner Block that the language needs to be precise. And if the language is not precise, we risk defrayal to the state. We also risk additional expense to Blue Cross Blue Shield to the amount that we did testify to, and that would, as we know, increase premiums for Vermonters.
Okay, we get this, and we've heard this,
Sure.
and what we know is that Jen received language late last night and early this morning.
Mhm.
We had asked for Monday, so I'm asking you all to go off and come back, and then tomorrow morning at 8:30, if there's nothing, there's nothing. And we will put in perhaps what we would like. Because there's some folks around this table that think PrEP and PEP is critically important for people who are exposed to HIV. So, and we know that there's a solution to this, so it has to come back. That's it.
Thank you.
Yeah, thank you all. Thank you and good luck.
Always good where you're coming. Did it right.
I can tell my team. They talk me at this.
All right, Jen, thank you.
Yes.
Thank you, Jen.
Said I missed the fun.
Can I have a quick question I have for you?
Yes.
Were any of the bills that we had on the calendar?
We're doing the baby food right now.
The calendar bills, Katie, they're your bills.
Okay.
Yeah. Okay.
Not Michelle.
No, we have, we just have.
And
We're good.
Yeah, Jan Ford.
Okay, let's move into
Thank
nine
you, Rose.
thirty-eight.
Same formula.
What are we moving on to?
Yeah.
5:36.
Yes, no, basic formula.
We've got it.
Not something you throw.
No.
I don't see. But it, a lot of things come out. They do that, but not everybody.
They do it. It's true. Okay. We're pretty full in here.
Yeah, that's nice more.
Oh, no, I love you.
Yeah, look at what they do. Picture this. Same thing, but that's fish.
Yes, I eat it.
Running to the back.
Beautiful.
We need to see.
Okay, how many people are in the room?
We're at our max vote.
We're max.
I am here for, yeah, I'm here for the 660, 657 and,
Okay. Is any of that baby?
Guys, what's a max?
no.
Six?
So I'll sit in on baby.
Okay, I think we're down.
Yeah, it's a.
No, that's rule seven.
Got it.
17.
So, I think you're one or two off. There you go.
One over, and that's not including whoever sitting there. So
Are you on 536?
Yeah, we are. So let's do that. Katie, we have a new draft. We put that up.
We do.
Got it.
Wonderful.
Morning.
All right,
Katie
Ryan.
Wickland, Office of Legislative Counsel. Here is draft 2.1 of 536. You were about to vote yesterday. Some issues were raised. So there's some new language highlighted in blue. First in subsection 2, not subsection, section 2. The added phrase, nothing in this section shall be construed to conflict with federal law or regulation. Sorry, that was section 1. Section 2, you have that appearing also because that is the same section being amended at a different date. And then you have a new section on page 7, section 3, infant formula stock supply. The provisions of section 2, which is the infant formula provision of this act, shall not restrict the continued sale of infant formula inventory in stock in Vermont prior to the effective date of section 2 pursuant to 4B, which is the contingency. So this is saying that anything that's in stock in terms of infant formula before the effective date of section 2 can continue to be sold after the effective date.
Yep.
And then the third, so here we're having that section 3 that we just added take effect July 1, 2027. And then the last issue that was raised was the contingency took effect on the enactment of legislation in other states, and now this has it taking effect not on enactment, but when the other state statutes take effect. So, for example, if California's legislation takes effect September or is enacted September 1 of 26, but it doesn't take effect till January 1 of 27, this would line up with the January 1, 27 effective date, not the enactment date. Gotcha. So that's it for changes.
I have suggested there, as opposed to California, is just have it 2 states with a population of 50 million. It doesn't matter and we're not tied to a single state.
So I think we're gonna leave it like this, because we've been talking about this one right along, and I understand that that's a suggestion that came to us from some of the advocates, but I think this will serve us well. In California is very close. The other states that are involved are high population states. Oh. If we're not looking at Wyoming.
Yeah.
Great, thank you. Wow, it's exciting.
Huh?
It's exciting. It's good.
Is there anything else, Katie?
Those are the changes.
Okay, and then. That's it. Okay. Questions committee.
No, do you, entertain a motion? I do it. So this is draft number 2.1. I would move that we pass favorably, to maybe draft number 2.1, H 536. The date for that is 4/29 PM, and it was, 4/29/26 and 1:56 PM.
Cool.
I haven't drafted it from yesterday.
Oh my God, we're quite, we're bragging.
So version
Okay.
2.1 and the date on the draft is,
Yesterday.
Yesterday's
Yeah.
date,
okay, so
29.
Great.
Discussion?
I'll get a home now. Just do the income formula with,
Okay. Call vote.
Yep.
Roll, Mr. Clerk?
Senator Benson. No. Senator Cummings,
Yes.
Senator Goodlett,
Yes.
Senator Morley, no. Senator Lyons,
Yes.
3-2.
Are you interested in presenting this?
Sure, I think you too.
Okay, and I will say this, sounds like an awful thing to do in baby formula, but there are very few manufacturers. And the manufacturers of formula are producing product for the European Union in a way that is different from what we're seeing in this country, so. We don't like the idea of our little babies being exposed to things that babies in the rest of the world are about. That might take on this.
I think we're rushing it.
Okay.
That's my take on that.
I'm sure. I'll think about brushing things. This one's been going on forever. Thank you, Katie. So that's good. We'll get a clean copy to Senator Gould. All right. Yeah, fun for the. Okay, the next bill we have is H 660, the opioid abatement special fund appropriations. And we've lost touch with this one a little bit, because we've been doing other things. So do we have a new?
Yeah.
So let's look at it.
budget.
I think so.
No,
No.
no, makes
No, no, no.
the homeless.
No, because it's all out of the.
This is the opioid fund.
Yeah.
I'm
But I
sorry.
thought that was going in the budget.
Yeah.
Just out of the fund.
Okay.
Yeah, this is the opioid fund
Fund was in the budget.
and,
There's one thing in the fund budget.
Okay. Things were good.
Except for one time.
I can show you.
okay.
Okay, so here's draft 5.1. You have your reader assistance heading. And if you remember, some of the appropriations that had been in the opioid abatement special fund to the substance use prevention fund. So you're seeing that items that had been on this list are no longer there. Last time we met, we looked at this 1.1 million to Department of Health for awarding grants to Burlington for the Overdose Prevention Center, provided that the department does not distribute funding until a location for the Overdose Prevention Center has been procured by lease or purchase. The Overdose Prevention Center is being fit up for its intended use, and the Overdose Prevention Center is currently or will imminently become operational.
So I understand what you said about the commitment. what I'd like to see in that was a clawback if they are not up in operation by 2028. That we just don't sit on that money because there's a lot of other things that could use it.
I mean, that would be a good suggestion. I think we'd have to go back and take testimony on that to understand where they are. At this point, they're still looking for venue, and there's a lot of discussion that's going on, so. Ordinarily, I might agree with you if we had, some time to sort of sort it all out. And that is something that the advisory committee is going to have to deal with when they look at there's a little section in here that has a hiatus for the advisory committee, where they take a break and then they evaluate what they've done and what they're doing. And I'm guarantee you that will be sure that'll be part of the discussion. So, yeah, what do we do when things don't go forward? That's a good point.
Okay, we have our intent language around the fact that it is intended to be annual through at least fiscal year 28. No changes in 2, no changes in 3. Just to refresh your memory, 3 was had to do with the opioid abatement settlement advisory committee and who they're consulting with and their process for looking at sustainable funding from applicants. Appropriation review, you made a decision to go back, this blue is to go back to language that the House had proposed, which is that next year, fiscal year 28, the advisory committee would only be looking at funding proposals for things that in statute had been identified as annual priorities. These are older changes. Quarterly reporting, reversions. Here is the Substance Misuse Prevention Special Fund. This is for appropriations that had been in the opioid abatement special fund section that are moving down to this prevention misuse special fund. Instead, you have language with regard to the Substance Misuse Prevention Fund being added in statute. That as part of its annual budget presentation, the department reports to appropriations and policy committees on its specific spending proposal for the fund in the coming fiscal year. And the report is to include an estimate of the monies in the special fund anticipated to remain unallocated at the end of the fiscal year. And then you have your effective date, which is July 1/26, and you're updating the title of the bill to reflect that money is now being appropriated from the Substance Misuse Prevention Special Fund. So this is 5.1. We've walked through most of these changes. I think we made a 1-word change the last time we met, and I can't remember what it was, but I think that is what got us from 4.1 to 5.1.
I vaguely remember.
Okay. I know. It's gonna, well, let me see if I marked it.
Okay. There is also language in the budget regarding the Substance Misuse Prevention Special Fund, the definition that we had talked about in here and set down hall. And the definition that's in there, I think, is somewhat incomplete. So we'll probably be negotiating that with the House during the conference process. And I'll keep you informed on that when you get your ideas. The other piece of that is that the guidance document for the opioid funds is pretty clear about the use of those monies for opioid abatement, not general substance misuse.
Is there a date by which all of the funds in the opioid settlement fund have to be dispersed or no? Okay.
We keep, well, okay. That's what looking me like. Yeah. Okay. Biddy. I know how you think. I know you're thinking. But there's time in there. You saw that section there for consideration, which I think is important. There's no question that it's not important, but I think in this case that where the bill has come from, the advisory committee and the Department of Health working together. So we have to, we understand that that work is important. And then, Katie, just wanted to look at one last
Oh,
thing.
I'm
That
sorry.
was just go quickly through the appropriations that are in there.
Do you want me to do that?
I would like that.
Yes.
Yeah. That would be a good idea. I mean, do you represent the joint fiscal office?
Yeah, but
Yes.
don't have, Melissa stepped out. Because I asked her to pick up, I made fresh copies for you.
Okay, she just went to get them.
I know, she went to get them, but I can't get the Zoom without her. Actually, I probably could. Let me get it to the Zoom.
Okay.
Um, But I have it on my computer. Supposed to get it literally, although, you know what, I emailed it to you. Well, emails. You just want to people send it?
Yeah.
And then look at anything else.
It should be faster because they have some people. I'm talking about the work.
Okay, and can I talk to you on the floor or
Yes, right.
Before four.
Before.
when we get on the floor? Can I
Yeah.
just run over and talk to you?
Thank you.
Oh.
Yeah.
Let's see, well, I have to say, we will. We said it this week, last week.
Can you also send me the Zoom? Sorry, I'm being very, very demanding.
I was just.
Oh. 80 put it up. Is that you? Who's thinking of that? You or me?
No,
Gee, is it you?
that's me.
Oh, okay. I'll tell you what, why don't you get off of it, and then I can drive it. Sorry. Although my computer's been so tricky. Maybe I should use yours. No, seriously, my computer's being really weird. Actually, if you don't mind, could I use it? I'm sorry. I know, I've been a hot mess. I'm sorry, could I use it?
Oh, you want my?
Yeah, I need to be able to. I'm sorry.
That's okay.
All right. The record, all night long, good for fluff, very disorganized.
We don't believe that. Be an epidemic of that.
Normally I'm more organized, but I'm, I was sort of-
Something to do with stress.
Yeah.
I was prepared to be unprepared. How's that?
My mom.
All right, so what you have here,
It's.
all right, what you have here is, like, this is 5.1. So I'll just highlight the change. Okay, everything that's changed from 5.1 is in red. So you'll see the first one is we have this 6A. Numbers, by the way, on this do not match unless they're in the bill, just to be clear, sections. They will in the fiscal. So 6A, we added recovery centers, goes to VDH. This is the 875 that we moved. It's not in this bill, but this is an opioid fund sheet. So you can see this is 875 that's in the budget.
That's the appropriate office. Okay.
Yeah, and so I put that in here because again, this is an opioid fund balance sheet and not a 660 balance sheet. And then you have the 1.1 for the opioid prevention center. Next change is the combination of the 900 and the 300 into 1.2 million. And then you have the PSET, the public safety enhancement team, you added back to 287,000. And then these next 11, 12, 13, and 15, those are the ones you moved out into the substance misuse fund. Initially they had put it, the House had recommended, just for the history of the House, Human Services had recommended this. At the time, we were told there wasn't enough money, there was no money in the fund, so appropriations put it back. We've now learned that we think that the fund can accommodate this, so that's why it's going back to substance misuse fund. And then the bottom line difference is, if this is spending, it doesn't include the reversions, but you can see the 6.6 million versus your 8.1 plus 875, which is budget. So it's 8.9, it's 9 million. If you go to down to here, this is all the changes. So the House spent 5.16. 5.16. You're spending 6.7 plus the 875 in the budget. So you're spending a little bit more out of the fund. The big pieces on that, just a reminder again, are the 800,000 and the 1.1 and the 875. So that's the recovery centers, opioid employment, moving that over, and the 1.1 for the OPC. So those are the big changes to the fund compared to what was in the House budget. The reversions are the same. And then the bottom line, you'll have $4.2 million left in $4.3 million left on the bottom line until the next settlement payment show.
What's
Yes. Okay. Not sure. I actually know the cycle of how they
annually though, one time a year?
I believe that they are annual. There's a lot of different settlements in that, and again, that doesn't include the pharma Purdue, which may be a lump sum. So there's the appropriations. I think it's easier to just kind of run through it on a sheet than to have changes run through the bill to give you a sense of how it fits within the lay of the land of things.
So when we're looking at the reversions, can you talk about what that means a little bit? Is this money that was appropriated from the fund and now hasn't been used? So it's going back into the fund. So I'm just trying to help Senator Benson with his concerns about having money committed and then not used.
And this came from a request from the health department.
Right.
You said, hey, look, these monies, we didn't need this much or whatever. We'd like this money reverted back to the fund. So now it can be spent for other things.
Okay, questions on all of this? This is not the bill, this is the fund.
Yep, and I will have a fiscal note that will line up with the sections of the bill,
Okay.
just like I had one for the House, and we can use that to the floor.
And the money for the 875 that was being moved into the base, but is now back being taken from the settlement fund is in the big bill,
Correct.
not in the bill in front of us.
Correct. That's why, yes, I made that point, that this is a balance sheet of the fund.
Thank you. This is late in the game, I know, but there's money for recovery. There doesn't seem to be money for treatment. And my understanding is that, that was 1,200,000 might be about 600,000 for resident for recovery and another 600 for treatment.
So that I know that there were some who were interested in having that money split out so that it could go to different types of recovery residences. So this goes to a 3 or higher level. And if it were split out, it would be perhaps at a different level. But that could happen. And that's what the House actually recommended. We're on a request, we put it together. And I think the House may have something to say about that when they see the bill. They may have something to say about a lot of this, but and don't see it as a big issue.
I just think treatment is.
Right, I agree. Okay, any questions for Nolan? It's a good question.
The balance. on 60 Gill Girls Prevention Center, the 1.1 million is coming out. What's the balance of that button?
This is all good.
This is all, I thought one was coming from one fund and some was coming from another fund.
No, this is the whole thing with the substance misuse fund. So that's the ones that are on Brandon's page 2. We pulled them out. Red ones.
Yeah.
So those are going back, but the opioid, OPC is coming out on the opioid.
Okay.
I think the confusion is substance misuse versus opioid settlement.
Yeah.
That's what I thought.
Okay, so the substance misuse fund
Thank you.
is a separate fund
That's it.
and it's funded from cannabis. So the percentage of the cannabis tax goes here and the percentage goes elsewhere. And this money is used for, and there's a whole list the health department has of various things that are being used to this fund.
And so there's also language in the big bill, not just to define the fund, the substance misuse fund, but also to look at what's in the fund, how much has been expended.
That's
How much
what I
is
was
left?
asking.
We've asked for that in the budget because it's gotten very confusing and we don't want to have an overlap for several reasons, one of which is legal requirements for the use of the opioid fund. We start to mix things up, we get in
Exactly.
trouble.
Thank you. That's exactly.
Yes,
And that's why those 4 things, the House Human Services Committee felt it was more appropriate for those things to be,
and they were,
and you guys are agreeing with that. And the only reason the House overall appropriations didn't is because there was enough money.
Right. No, I get it. I just, there's 2 different things going on there. Yeah.
For the states.
okay. So we have this, we've got a fiscal note
Yeah.
to the bill.
Once the bill's passed, whoever the report is, I'll make sure they get a copy of this fiscal note because it'll have to approach.
Have to go down the hall.
Yep.
Can I offer an amendment?
You can offer an amendment.
That would be for Katie. I think.
Yeah. Sorry.
And I think it's agreed upon by the parties, but then, so to split that 1,200,000 into 6 and 6, and 6 would go to the Department of Health for Substance Use Residential Treatment. Beds at the American Society of Addiction Medicine, level 3.1.
I actually like that suggestion. I don't know if it's, what.
More information. So it's subdivision 6. So 1.2. And what would you like?
So
I
split it to leave 600,000 where it is and then move half of it, so 600,000 to the Department of Health for Substance Use Residential Treatment beds.
It has to be opioid,
For opioid use to
opioid misuse treatment.
Yes,
This is the problem.
at the American Society of Addiction Medicine, level 3.1.
Do you have that? Do you want me to do that right now?
Sure.
So I get a different version again. Thank you.
6.1?
Oh, no.
Let me do that right now.
I'm just waiting.
Just take a minute and do it. Seriously, let's just get this.
Okay. I'm running.
There's no subject line, just.
Jessica, do you want to say something?
I did, if you would allow me to do that. Thank you. I'm Jessica Schifano, Department of Health, Policy Director. And we were just made aware of this amendment this morning, about the split. And, just to clarify, in the House version of the bill, they had 900,000 for new recovery residences at level 3 or above, and then 300,000 for new recovery residences in certain geographic areas. And the department has recommended putting that all into 1.2 million total that we could have more flexibility to use in conjunction with the RHT funding that is going to come through recovery residences. And so with the RHT funding, we can only fund some of the things, like we can't fund like the infrastructure and some of the startup costs. So we would recommend keeping that 1.2 million for recovery residences, specifically, and not carving out the 600,000 for treatment. So because that's gonna be needed to support the expansion under RHTP. And if you all are interested in adding 600,000 for more residential beds out of this, we're not opposed to that, but it is just going to put more budget pressure on
Understood.
the account.
Yes, I know, and we've been going through this one for a bit, a lot of discussion about it. So I think we'll take Senator Buick's recommendation at this point, send it back. Want to make sure that different treatment levels are provided appropriate funding, and I think that's what we're getting to. Not sending it all out to one organization. There is RHT funding. And I understand that the grants are beginning to, for the RFPs have gone out, and the requests are coming in left and right. I talked with the director yesterday, and she'll come in whenever we like, but doesn't have a lot of new news.
Yeah.
No, this will change the fiscal note.
Sure will.
So, I'm sorry, yes.
What
So
number is
here-
it now?
It'll be 6.1. So here's 600,000. And now this is a subdivision 6A. And now you have a B, 600,000 to the Department of Health for opioid use disorder residential treatment beds at American Society of Addiction Medicine level 3.1.
American Society of Addiction Medicine level.
And if when you vote, you vote pending edits, because I will have to run this through.
Oh, yeah.
Yeah. Hopefully no changes. You never know.
Okay. Discussion.
What's American Society of Addiction Medicine level? 3.1.
Remember, we looked at the different levels.
Yes.
One up.
I don't remember 3.1.
So who would like to help us understand level 3.1?
I can give it a try.
Okay.
Put treatment. I mean, this is, so what is being added to the bill, so Jessica Shapano, Policy Director, Department of Health. What's being added to the bill and the level 3.1 is residential treatment. It's low intensity.
Okay, so
residential
this is
treatment.
low. Okay.
So this, as opposed to the different levels of recovery residents that we talked about, there are the NAR levels 1 through 4. And NAR level 4 is very similar to the 3.1 residential treatment, where there is an integration of
Yep.
treatment
Services.
within the
Yep. Thanks.
Yeah.
And make folks action circles just a little extra clarity. We don't have many, right now, Dennis promises of only level 3 residents. And that's, so we don't have anything higher than a level 3 of recovery residents. It's as Jeff said, it, once you move past that, it is similar.
I can't hear you.
So once you move past level 3 in recovery resident standards, you're getting very similar to the same as level 3.1 in treatment standards, which are different.
Go ahead.
Gail Zantz on behalf of Recovery House. So the actual definition I have of ASM 3.1 is low intensity clinically managed residential treatment. And currently, the reason that we had talked with the Department of Health about removing the or above part of section 6 is that there currently are no level 4 recovery residences in Vermont, and they were in agreement. I don't want to speak for you, but they were in agreement with removing the or above.
Okay. The recommendation that came from the advisory committee included the split of the 1.1. So in the original underlying bill. I think it was 300
What came over from the house?
and 900.
It's 9 and 3, I think.
Agree, that was the original. This really goes back to the recommendation from the advisory. I honestly feel very uncomfortable deviating too much from what the advisory committee was. Because they've worked really hard on all of this. Okay. 9 and 3. Go ahead.
Yes, but I just wanted to make a clarification that the OSAC did recommend the 9-3 split. But the 900 was for recovery residences, level 3 or above. And the 300 was for new recovery residences in certain geographic locations.
Understood.
And that was what the House had in their version of the bill. So
Okay,
no
well,
one
let's
had-
do it. We're gonna do this, and
Yeah.
then the bill will go back to the House, and they can evaluate the difference between, our language and their language. We don't have, yeah, so we'll do that. And I'm sure that there are members of the House Human Services Committee who are very interested in this. Okay. So do we have the draft?
I just sent it to Callista. She's running to print a copy, maybe multiple copies, but,
Okay.
and now the editors are looking at it, so I can put
Alright. All right, so knowing that. Oh golly, the next bill that we're gonna be picking up will have discussion as well, and that's gonna be 657. And we have, which one has the least? Probably 816.
816.
Yeah, we might just jump to that one. We need a little break from the intensity of. And when that comes back in, we'll jump back to it. So it's 816.
Okay. Here is your latest draft of 816. This is draft 3.1. Thank you very much. Appreciate that.
Tell me when you're ready to do 660.
I'm ready. 616.
Yeah, we wanna
Hey,
go.
I'm ready.
So.
Yeah, oh,
Yeah,
okay,
we're on
that's good.
660.
As long as
I
you
would-
vote pending edits.
Yeah, okay, if we vote, we'll vote pending edits.
Does anyone else want to make a motion, or I'm happy to?
Yeah, he's ready.
Okay, I move to pass favorably H660 pending amendments.
Edits.
Pending edits. It's, so it's draft number 5.1 now.
Now 6.1.
No, hold on, let me finish. It's draft 5.1 pending edits. It will be 6.1.
No,
You're voting on draft 6.1.
Okay, we're voting on draft 6.1.
Pending edits.
And that will be, obviously 4/30/26.
Yep.
Okay. I think that's good.
Are you all set, Madam Chair?
Oh, yeah. Any further discussion? No one will get us a fiscal help. Okay,
Senator Benson,
Yes.
Senator Cummins. Senator Gulick.
Actually cute, like, I know it's hard to say. I know it's hard to say. Sorry. It's good, but no one gets hard. Very few people get it right, but yes. I get it right. Yeah, exactly.
Senator Morley, yes. Senator Lyons,
yes.
oh, no.
Probably gonna fall on top of my shoulders. Is there anyone who would like to report this? Okay. I'll report it. Well, the challenge is that the advisory committees will have to stand up and have something to say. Thank you.
At the end of there. I'm sorry. We did a different version.
Thank you, Kate. That was good. So let's jump over to, jump to H816,
Okay,
if we could.
sure, here it is.
Here it is.
You have not made any changes since the last time you looked at this. Do you have a walkthrough last Thursday or Friday? So I can bring you through the latest changes again, if that would be helpful there.
Let's just go through it. Yeah, we're on draft 3.1.
You are.
Yeah, okay.
So you have a purpose section. It is the purpose of this act to safeguard individuals seeking mental health services and from psychological harm, including death by suicide, by ensuring that these services are delivered by mental health professionals and not independently by AI systems. And you have your section 2, which has is where there's a list of unprofessional conduct by professions regulated by OPR, and you're adding to that list for any mental health professional engaging in the prohibited use of AI pursuant to section 3. Section 3 has a series of definitions. You have some changes in your definition of mental health services, including that you're adding an including clause that contains therapeutic decisions, therapeutic communications, generating treatment plans or recommendations, or detecting or interpreting emotional or mental states. Can we say emotion? Interpreting emotion or mental states. I guess that could stand. Therapeutic communication.
Interpreting emotional.
Well, it could be either, I think.
Okay.
Interpreting emotion or emotional states. It depends.
Got it.
So we've had it as emotion.
Okay.
If you would like to change it, you can.
That's okay.
Therapeutic communication means written, verbal, or nonverbal interaction. And you have a such as list, a list of examples. So we've been through that. Subsection B, an individual, corporation, or other entity shall not offer or provide mental health services through artificial intelligence without the review and approval of a mental health professional.
Yeah.
And subsection C, we have language that a violation of this section by a corporation, an entity, or an individual, so we're tracking what we have here on line 6, who is not licensed, certified, or rostered as a mental health professional, is a violation of the Consumer Protection Act. We've added in a penalty of $10,000 for each violation. And subsection D, that nothing in this section precludes a mental health professional who's operating within the scope of their professional practice from utilizing AI tools that are HIPAA compliant, provided that the professional reviews and approves any mental health services. So that references back to your definition of mental health services. And then section 4 is the Board of Medical Practice. One of the professions within the list of mental health providers is regulated by the Board of Medical Practice and not OPR. So this is sort of putting in parallel language that engaging in the prohibited use of artificial intelligence pursuant to 7115 is unprofessional conduct. You added a report coming back in January asking OPR and the Board of Medical Practice to look more broadly at the use of AI in regulated professions. So that would have recommendations for legislative action. And then your effective date is on passage. And that's it.
Questions for Katie?
Sorry, Dr. John.
So I had raised the question, or is to whether or not if AI is out practicing, they're not a licensed professional, and that would be illegal to begin with. And so the question I had was, do we need the bill, or are we already covered? Because we're trying to make sure AI is not out there practicing. And so AI doesn't have a license, so isn't that already an illegal act?
So we talked about possibly hearing from OPR on that.
Right.
So your question is basically, is AI, because it's not a licensed mental health practitioner, already violating the law in Vermont. I think that is a difficult question because all of the professional regulation statutes regulate people, and this is sort of regulating a service, a technology in a way that I think the OPR statutes hadn't envisioned. So I guess I struggle with that question because it is sort of not exactly apples to apples, but I think what your question is raising is that this is new technology that, you know, our statutes, when they were passed, didn't necessarily account for. So that's not, I sense that you're wanting a yes or no, and I don't
Well,
have the
no,
answer.
I'm just raising the question because.
Yeah.
This, we're in new territory
Yeah.
and it's something out there practicing without a license basically.
Yeah, I hear the question and I'm wrestling with it, I think.
Well, yeah,
I would agree, it's not a human being, so it's not, falls into a different category.
I spoke to you at some point, Katie, on page 4 of 6, small b,
Right.
and I'm still struggling with it. An individual, corporation, or other entity shall not offer or provide mental health services through artificial intelligence without the review and approval of a mental health professional. My question kind of was, if there was someone that was seeking treatment and they were on an AI, whatever, and they were thinking about hurting themselves, and the AI said, no, please don't do that because of A, B, C, D. But would that go against this provision, small b?
So this language in subsection B is pretty neutral. So whether the AI system is responding with something that the practice of mental health providers would find is problematic, or they find actually that is in line with what we would recommend, it doesn't matter. It's the ban on the provision of mental health services without review and approval of a mental health professional is neutral on the viewpoint that's being presented by the AI system. That help?
Can you give me an example?
So regardless, in your example, somebody is entering into a chat box, you know, I'm having these thoughts.
Right.
If the chat box responds, yes, you should commit suicide, or no, you should go seek professional help from a mental health professional. Both of those responses are prohibited by this language because they have not been, because it's mental health services that have not been reviewed and approved by mental health.
Right, exactly. So 50% is good, 50% could be bad.
We don't know.
or the chat box won't call 911 and say, you need to do a welfare check on this person. Nor call, you know, I mean, there's so many, if it's connected with a mental health professional, then the mental health professional gets involved.
No, I completely agree with that, Senator. My question just is, what if this individual's at home and this occurs and there's no professional around and no one's going to connect to the professional, and this individual's on the chat box, and the chat box says, no, please don't do this. That's great.
That's great.
But if, but this decision is being done without the approval of a mental health professional.
Just please don't do this. It's not generally enough. You know, like this is really a bad idea.
Right.
Does it go forward and
So there's
I mean,
positives, there's positives to the,
yes,
and there's negatives.
Yes.
And so I'm just trying to make sure that a negative is solved. I want to make sure,
I think we're trying to harness the power.
trying to. I'm
I know
struggling.
that,
I'm struggling.
Representatives of Google had reached out with this question
Yeah.
and has recommended that we do a study. on this. But I'm, you know, it is a whole nother world of regulation and understanding. So all we're looking at here is making sure that whenever there's counseling, it's through a licensed professional. That's what we're doing here.
Yeah.
So, but going to the next step and looking more thoroughly at chat boxes of the world and inquiry into Google or other places. That is that's a next step. And that's
Yeah.
something I think we could all, some of us could get our arms around, but it's gonna take a lot of arms.
Okay, so there's a lot more stuff to think about.
I think there's a huge amount to think about. I think it's a great question. And I know that it was brought to my attention as well, but I'm just trying to keep us focused here. When this bill started, it was like this, and now it's here, so it's manageable.
I just wanted to say, I think you bring up a good point, and I think the technology is moving so fast. It's like the neurological rights bill. I mean, it's in a year from now, who knows? It'll be, so we're trying to get in front of it, but also knowing that it's all gonna change, and a lot of these bills probably have to change.
Some's good, some's bad, and it's so
Yeah,
hard for
right.
me to.
So where are we with this bill?
A lot of color on it.
There's a lot of color in it. Yep. So you've walked through this version twice without changes.
Looking for. Okay, I have the motion person today. So it's draft number 3.1, is that right?
3.1.
Okay, so I move to vote favorably committee draft number 3.1 of page 816, which was from April 22nd.
We can pick a vote. You pick a vote up, which is back. She's been giving us. Discussion? Any more discussion? Okay. Senator Clerk.
All right, Senator Benson,
Yes.
Senator. We'll hold this open, you said, Madam Chair?
Yes, we will. Yeah.
Senator, we'll wait for Senator Cummings, Senator Ulick.
Yes.
You're gonna have to continue to remind me of that. Senator Morley, yes. Senator Lyons?
Yes.
We'll wait to hear back from Senator Cummings.
So it's up, right. So right now it's closure.
Yeah.
Okay, so who is going to report this one?
But
This was.
You want to report it?
Yes.
Oh, goody. That would be great.
What would ask me questions about it?
I will.
That is one of the unwritten rules.
I know, I'm sure it is. I'm sure it is.
All right. So Senator Benson is a reporter for that one. That's great.
Okay, I'll get everyone clean copies on all of these when I have a chance to clean up the
Yeah,
draft.
I know. I know.
A
You
little
know
bit
how
later
precious
today.
your time is.
Second choice resolution.
Yeah, let me write that down. I sure can.
So we're just a little bit over time. We have 6:57 to look at with Katie. And then we're gonna take a teensy break and go to H 9:38. So we're gonna go to not 6:57 and see where we are with that.
Okay.
That's a big,
Okay. You have, but they're tiny. And one was tricking people. My proposal thing have changed, so that one is not super exciting. So you're looking at draft 2.1 here. Let's see. Trying to find the changes. The first change, was in section 4, the proof of certification for the unaccompanied youth. The version that left the house designated Elevate services as preparing the documentation. And I should have caught this before it left to the house, but we really don't specify in statute a specific nonprofit organization. So I've rewritten it that the department shall contract with a community organization that serves homeless and runaway youth in Vermont. So that was my correction. And then you heard testimony. Oh, here we are. So this is the list of how a youth can use the certification form, the unaccompanied youth can use the certification form, and you heard testimony, and I was asked to add this proposal to the list: participate in a court diversion program or in a youth substance awareness safety program, and that was presented to you last
Willa
week.
Farrell, right,
Willa
yeah.
Farrell, that's right. So those are the two changes that I've been asked to make, or have asked to make with regard to this first one with the using more generic language.
Okay, we don't seem to have this version. I see 1.4.
No.
Right, is that right?
Yeah, this is 2.1.
Right.
It's. I'll have it for both right now.
I was just looking at Katie's.
Yeah.
So Katie, are you, this is a proposal to amend that what we're putting in, we're not doing strike all or
This is a strike all.
it is a strike all?
It is, yep. And you have received other testimony and requests for changes, from different groups. But this is what I was asked to do at this point in time.
Okay. I mean, we've had so much coming at us in a short period of time. It is challenging. This one is challenging. I think it's, I know that DMH sent some
Yeah.
information in with concerns about restraint when they're putting contracts together for out of state. And
I was a little confused
I was
by that.
glad to hear that.
So, well, I mean, it might be clear, if I got a little bit more information, but the section that they're referring to refers to, children in DCF's custody, not DMH's custody. And I think the, Child, Youth and Family Advocate raised that too. So maybe more clarity around there. And then the second thing they raised is, with regard to how a youth could use the certified form in front of mental health services, they asked us to have it say outpatient mental health services, but that's already allowed in statute, outpatient mental health services. And the rationale was that a child should have, if they're engaging in other types of mental health services, should have assistance from their parent or guardian. But the point of the section is that so I think I just need more clarification to understand those recommendations
From DMH.
from DMH. Yeah.
I'm going to look at the the family advocate, Matthew, or Lauren in terms of the language that we have here. And I know that you had put some recommendations again, but as the bill, as Katie, do you mind putting the bill back up, Katie?
Oh, I'm sorry. Yeah, sure
And
can.
as we've gone through the bill, do you have any specific comments you'd like to make?
About this last, Matthew Bernstein, Child, Youth and Family
Yeah, thank
Advocate, the last thing that Katie said about the
Start with
unaccompanied
that.
youth. Okay, so I'll go backwards. I think I agree with the rationale. The current law does allow for outpatient, and the whole point of this bill is to provide a broader array of access for youth who are living on their own. I sent a fairly detailed
You did.
legal interpretation. I think it gets technical, but I think, and I could look at the language, but in the restraint and seclusion section, the definition of child, it boils down to it's a youth in custody or it's a program regulated or licensed by DCF. And so, and then the contract provision refers to this section. So that same definition of children. So therefore, I don't think it pertains to DMH placed children.
That was section 13.
I believe that is correct.
Trying to find the definitions.
Well, the definition is,
So it doesn't need to change in the bill, sections of the question.
No.
Okay.
That's why I haven't looked at it.
Here's child, so child or children means child or children in the department, meaning DCF's custody.
Yeah.
Or receiving care services in a program regulated or licensed by the
I'd
department.
also point out, this is all chapter 51 of title 33, which is the juvenile judicial proceedings chapter, so that sets the frame of fairness. And I think, I think the simple answer is, this bill is there've been a lot of compromises already. There's still some things in this bill we don't like, but I think voting it out, and on to the next stop, is our recommendation. If there's any other questions, we'd be happy to answer.
Thank you. There you are.
Hi, Deputy Marshall, Department of Mental Health. Laurel Olin is available to answer questions about the contracting issue. In terms of our concerns of us being able to, DMH being able to contract for out of state residential placement because the contract for health through DCF. And she's obviously available to answer.
Okay, Laurel's up there then. Why don't we hear from Laurel? That's fine. Welcome.
Thank you. Hi, Laurel Oland, Director of the Child, Adolescent and Family Unit at Department of Mental Health. It is correct that the language speaks specifically to children in state's custody, but the Department of Mental Health, Department for Children and Families have worked really closely together over the years to align our contracting process so that we don't have multiple contracts from the state with the same residential program for the same purpose and services. And so there is typically one contract from the AHS department that includes coverage for the other department. So DCF holds the majority of contracts with residential programs in state and out of state. And so if this is setting prohibitions for DCF, it will potentially have impacts on DMH funded placements as well. And so that was our concern, that especially for out-of-state placements, what impact might these requirements have with those contracts? Will those programs simply decide not to contract with the state of Vermont, and therefore that impacts our ability to use those programs as well?
Okay, thank you for that. The language here is DCF, and I think the fact that DCF and DMH are working together to have agreeable contracts with one another is a good thing. This might mean some further discussion between the two departments to have the contracts aligned with one another. So I don't think we're going to solve all the problems with this within the bill itself. So some of the administrative problems, I think, are going to have to be sorted out. I don't know how we can do that, to be quite honest with you. And I did read what you sent in, whatever it was. And it was just recently, it was yesterday or the day before. I read it.
Yesterday.
Yes, I read it. So, yeah, so agreed. And I think we do have it posted, but Calista will have it posted for us.
Thank you.
But Laurel, appreciate everything that you're saying and understood the difficulty and the complexity of trying to sort out a contract with another department, and then not to mention with another state entity. So understand, as I said, no way we're going to solve all of these problems within this one bill.
If I might add one other component to this, which is related to the unaccompanied minor status and access to beyond the outpatient level of care that you just spoke to. So if we are talking about being able to have youth under that status sign and request residential treatment, that will also impact our ability to place youth out of state in residential programs in other states under the Interstate Compact for Children, because that requires a legal guardian or parental signature. I don't know if those states would accept a unaccompanied minor signature for that process. And so that could potentially inhibit us for using any out-of-state program for these youth as well. So it's just another ramification we're trying to make sense of and how this would play out.
Okay, I'm going to turn to Matthew Bernstein to a little tiny reply to that. I have my own sense about it, but I think the expert is needed.
I will just say, in general, it is a feature, not a bug of this bill, that this bill explicitly says these protections for these youth are a baseline, and they are too important, even if they affect contracting, even if they affect the ability to place the youth. And I think what we want to be talking about is not how easy or hard it is for the state to place a youth, but how do we get these youth the treatment that they need? And I think that is in everybody's interest. And I understand, like, it's it's hours in the day and hair, like that's what happened to my hair, like contracting and is a pain in the butt. We have to do it in our office, right? I understand that, and I think, and I recognize that, and I think that is you could call that a side effect of this bill, but this bill explicitly says this is a baseline, this is too important, this is safety and due process for youth, and ultimately what we want to do is have a more responsive system, not make it easier to place youth, right? And so I think that's the core of this bill, and so that's where I keep coming back again and again.
All right, thank you. Okay. So
Madam Chair,
oh, sure, Erica Radke, go ahead.
Thank you, Eric Grant, Deputy Commissioner of Family Services Division. I do agree with the Office of Child, Youth and Family Advocate in terms of the intent of the bill is safety of children. And the issue I want to just sort of pivot from the idea of we're talking about contracting. Really, we are indeed talking about the safety of children, being able to find appropriate placements for them, whether in state or out of state. And that thing in the bill that makes that more difficult, it may not simply be more time, it may be we may not be able to find appropriate placements. So ultimately, it is all about safety.
Understood. Yeah, I think it's always more complicated. Yeah, I was looking at the sign we have over there. It's always more complicated than that. Yeah.
Can I
Agree.
ask? Can I?
No, right now.
I know.
I think we're at a stage here where we're trying to get to this, and you're going to have plenty of time with this when it comes right back to you. Understood. Okay, so yeah, so we hear the balancing and the juggling that's going on, and the difficulty of really providing protections for kids. Juveniles who don't have a guardian or a parent. Just really couldn't imagine that myself. It's very difficult. Maybe at some point we'll talk with you folks about establishing a guardianship program, a general guardianship program through the Office of Family and Youth Advocate that would adhere to the protections for these kids in a way that we don't have right now. I mean, I think about what the Secretary of State does for people who have been sexually abused, and they have an address and they take care of them over there. And I would see something similar if there were some place that we could put these kids and offer the protection that they need like that. Somebody else can think about that. Okay. So Katie, give us a look one more time at what we have in front of us, and then we'll go ahead.
Sure.
Perhaps this is.
Oh, are you voting on this one?
Are we gonna, do you plan on voting on this?
Yeah, did we get a motion?
Yeah, that's what I was thinking.
Okay.
Did we have a motion?
Katie, make a motion.
I think, you know, hold on, I don't think about, oh,
Get rid of all
sorry,
these things.
I might have missed it.
Is it 3.1?
Do we have
Yeah,
a,
but you can amend it.
no, do we have a member of the working group that is a family, like a parent of?
Yeah,
We can't.
We
see what
do.
I'm looking at.
yeah.
She asked me.
What number?
Yeah,
What's the draft?
we don't need.
That's what
It-
She's getting it right now, but
It's 2.1.
That's 2.1,
But I'm
okay.
looking at the members.
I only have one. But
Individual lived experience being one of the. Okay.
Just
Okay.
that we were paying.
Yes, okay, I will make a motion. I move to. I want to move, draft 2.1, that's
2.1.
657, favorably out of committee, and this draft was, 42726. Got that.
okay, is it 2.1?
2.1.
Yeah,
2.1.
the date was
May
4/26, she said.
Yes, 427.
Well, 426, I thought you said.
No, 427.26. The year is 2026. That's a lot of.
No, I gave that cover.
You used to be on appropriations. You can be.
I'll figure. Ready?
Any more discussion? And we'll hold the vote for Senator Cummings, please.
Where is she?
She's testifying on the yield bill
Oh.
at Ways and Means.
Do
So for taker.
you have any more questions, Senator? You?
I just have a comment that I think this is a really good bill. I think it's us in a better direction. And I hope we can strive to someday not have any out of state placements and take care of children here in the state of Vermont, just like our special education extraordinary costs that we have in the education field, in the education world. I'd be great to be able to take care of kids here, but I know that is aspirational at this point, but it's good to have aspirations.
I would agree, but I'm still concerned about the unintended consequences of putting some of these things in here. As we heard about being able to place children at the right places out of state.
Well, the DCF piece is pretty clear. They're already doing that. Yeah. And so this is dealing with those in DCF custody. So that I think there's some reassurance. This stuff did not take a step into the Department of Mental Health. The concerns that we're hearing now are internal administrative concerns about how to draft contracts when kids move out of state. Not in the bill. It's an important issue, and we'll hope that A, it could be relieved administratively, or B, that we'll see additional legislation going forward. It's never easy. So.
Excuse me, on the actual field.
Tough.
I can say one thing to the senator's question about
Okay.
collaboration.
Yes, no, go ahead.
Matthew Prince, Child Youth and Family Advocate Center. I just want to say, if in fact, if this bill passes and there are unintended consequences, we, as we always do, will work collaboratively with DCF to address those. And I can see how there's a lot of moving parts in this bill. And there could be, but I think the data is strong in the other direction, showing why the protections are necessary. And I understand we have concerns about contracting and it's hard to prove a negative. We don't have any hard evidence, but if something comes up, you know, we are realistic. We're not out here trying to just say, you know, tough luck, right? Like we understand that this is policy and there's daily operations, and that's our job within state government is to address those as well. So that's all I'm just.
Okay. Okay.
Senator Benson.
Yes.
Wait for Senator Cummings. Senator Hewlett.
Yes.
Senator Morley, yes. Senator Lyons.
Yes. And we hold it open.
Yeah.
Thank you all. This is a difficult bill. I know it's controversial pieces to it, but I think we've done really good work on it, and I appreciate that. And I'm looking for a reporter.
Senator Cummings, I think, wanted it. No. She's not here.
I have things planned for her.
Oh, do you?
No, we won't give this one to her. I think
It's so funny. I didn't think Jen about it.
Oh, thank you.
Alex.
This has to go.
Yeah.
Finance.
I have to vote. Probably.
Whether it's money, I can't remember. Yeah.
Well, it's fast. Are we adding folks to the list or? And there's.
That'll go to a probe.
That'll go to pro.
Yeah.
There we go.
And then, I don't know.
So, yeah, somebody else has to report it, 'cause I'm gonna get.
I mean,
All right. And you have health. you will have help, and I think that's first. I'm doing this one. I didn't write down who's using these. Oh, you're like doing
He's got AI.
Oh,
Yeah.
you've had AI.
Yeah. I guess.
So we gotta get her to do something in this room. That's
Yeah.
sure, yeah. Still, she
Right?
But when are these-
That's what we want to trade.
Okay, so we're gonna take a break until 10 to give it